Ladies and gentlemen, this is your host, Dr. Aftab Ahmed, with the program Innovative Pakistan with Dr. Aftab. And we are live from Planet FM 87.6 from Radio Pakistan. So, today we are going to discuss a very important topic, and that is thalassemia scenario in Pakistan. So, we are going to discuss in detail what is the scenario of thalassemia in Pakistan, what are the recent advancements in the field, especially what are the breakthroughs that is happening in the world and also started in Pakistan, and what we have to do to manage this disease in Pakistan, because there is a huge burden of this disease in Pakistan. There are over 100,000 patients who are suffering from this disease, and this is not only a suffering from the patient but for the whole family. So this disease actually need an immediate attention. And to discuss all these scenarios and scenario of disease in Pakistan, we have a leading expert of the field, Professor Dr. Hasan Abbas Zaheer, with us today. So Professor Dr. Hasan Abbas Zaheer, he has a background of medical sciences. So he has done his graduation from Rawalpindi Medical College at that time, and then he has served in PIMS, and for his specialization he went to UK, where he earned his PhD degree, and then he has served at various positions in Pakistan. Especially his contribution for safe blood transfusion programs are enormous, because I have followed that program over the years. I was following his activities and really impressed at how he has started that program from scratches, and that was a leading program in Pakistan, and it has served the community so much that we are so much thankful to him that with his contributions we are protecting the people from so many infectious diseases. So he has served at various positions. So because he was here in our program earlier as well, so normally what we do in the start, that we have the introduction of our guest, his own journey, but as he was here in the program before as well, so we will directly start with the topic of this program. So first of all, thank you so much, Dr. Saab, for joining us in the studio, and we welcome you. And now let's have the discussion on very important topic. So the topic is, as you know, we are going to discuss on thalassemia in Pakistan. So what is the current status of thalassemia?
The current status of thalassemia is that we are now number one in this disorder. This is not a very good distinction, but there it is. We are among the highest burden country in the world, and the burden of disease in Pakistan is believed to be about 100,000 thalassemia major patients who are dependent on regular blood transfusions every 2 to 3 weeks for their survival. And in this number, we are adding about 5 to 6,000 new thalassemic major patients every year, as we are believed to have a prevalence of about 5 to 6% in Pakistan.
Oh, that's so alarming, because we are number one in so many other diseases. Just like we know that we are number one in the world in hepatitis C cases. Now we are also number one in diabetes cases in the world. So the health scenario is not very good. That's why all these conditions, like if we talk about diabetes, that is mother of so many diseases. So that's very sad situation in our country. And hepatitis, which is a very fatal disease that has so many complications. So we are also number one in that. And you just had mentioned that in thalassemia we have the maximum burden of disease, although there are so many other countries which has huge population. Just like if we talk about China or India, they have over a billion population, but they don't have that much burden of this disease. So why there is so much prevalence of disease in Pakistan?
Actually, the burden of disease was higher in the other countries, which had a greater prevalence also, but they addressed the problem. And because it is a preventable disorder, they worked on the prevention of the disorder. And so in many countries like Iran, Greece, Italy, Cyprus, Turkey, there have been no thalassemia major births for many years now.
Wow.
And so they are only taking care of their existing population, thalassemia major population, and they are giving them very good care. And so, a disorder which was previously considered as a childhood fatal disease.
Mm-hmm.
It is now in the West considered as a chronic disorder requiring multidisciplinary care.
Right.
But unfortunately, that is not the case in Pakistan. It may not be a childhood fatal disorder anymore in Pakistan,
Mm-hmm.
but it is an adolescent fatal disorder.
Right.
So this is a very sad situation
Mm-hmm.
because it's a preventable disorder, but in Pakistan it is not being prevented.
So you had just mentioned that we are adding 5 to 6,000 more patients each year, and this disease is like so horrific, as we have mentioned, that it's not only for the patient but for the whole family, and it's also a huge burden on our healthcare system. So as you have given the examples of so many countries, just like Cyprus, Turkey, or Iran, they have prevented this disease. So what preventive measures they have taken, and what Pakistan should do in this regard?
Uh, Different countries have different dynamics of the disease. Mostly it is prevalent in the Mediterranean countries and in Southeast Asia. As far as Pakistan is concerned, the dynamics here is that this disorder is mainly limited to the affected communities.
Right.
And because of consanguineous marriages, the thalassemia gene remains trapped within the community and proliferates. So we have cases where one family has more than one thalassemia major patient, and the others are thalassemia minors, which are symptomless, but they are responsible for progression of the disease. So, as far as restraining the spread of thalassemia is concerned, as far as Pakistan is concerned, we have to focus on these communities where the disorder is. And in other countries, it may be the thalassemia gene may be evenly distributed in the population. They would
Right.
require different strategy. But for Pakistan, with a restricted community scenario, we don't need mass screening. We need to focus on the affected community.
Right.
In that community, you don't have to go and search this community. They come to you every month,
Right.
more than once sometimes, and they come to you in the thalassemia centers. And if they don't come to the thalassemia centers for their regular transfusions, they are unable to survive.
Right.
So reaching out to this community is not a problem, and it has been proven more than 3 decades ago that Pakistan has this kind of thalassemia situation. And so the most common sense strategy is to contain this disorder within the community, do extended family screening. When the patients come to you in the thalassemia centers, engage with all the family members who ever come with the patient, and then motivate them to have extended family screening so that the thalassemia status of each member of the family is determined. And because they inevitably tend to marry within the family, so before marriage you would have their status, and if the two thalassemia minor intend to get married to each other, you can provide them genetic counseling. And even otherwise, if they are marrying someone without thalassemia minor status, even then you have to give them genetic counseling. So genetic counseling, extended family screening, and genetic counseling, and taking good care of the existing thalassemia population, that should be the priority strategy in Pakistan. Unfortunately, we are not following this simple strategy.
Okay, I think we can definitely reduce the burden of this disease. As you have mentioned, it's a very simple strategy. It's not like we have to reach out to so many people and then we have to do the screening, which is like a quite a cumbersome process in which we have to take the samples, we have to do the PCR, and then we have to find the mutations. So I think we can stop for a while and let's have some discussion on this disease itself. As we know that this is a genetic disorder, but there are some terminologies I think it will be valuable for our listeners and those who are watching our program to know that actually so you can explain it a bit more what kind of this disease is, what is this thalassemia major, what is thalassemia minor, who are the carriers, so what is like who are symptomatic and who are asymptomatic.
Yeah, there are basically two types of thalassemia: thalassemia major and thalassemia minor. Thalassemia minor are asymptomatic, and they're just like you and me.
Right.
But if two thalassemia minor get married, then in every pregnancy there are 25% chances of the offspring having thalassemia major,
Right.
and 50% chances of having thalassemia minor offspring, and 25% chances of a completely normal
Right.
offspring. So there you have it. You need to stop this 25% chance of thalassemia major offspring coming into the world, getting born.
Okay, nicely explained. So if like there are two people who are thalassemia minor, they don't have the symptoms, and if they get married, then there are 25% chances that the baby who is born to this family, they will have the symptom of thalassemia, which is thalassemia major. So if the baby is born, so what happens next?
Even before the baby is born, during pregnancy, you can determine the thalassemia status of the fetus.
Right.
And if in the first trimester you do that through it's a process known as chorionic villi sampling, and it can be done. It is in the hand of the experts. It is not a difficult procedure. It is a simple outpatient procedure.
Right.
And you can take the sample from the fetus and have it tested in a specialized laboratory, and you can determine the status of the offspring, whether it is thalassemia major or not. If it is thalassemia major, then termination of the pregnancy is possible and also permissible by religion. In other Islamic countries also it is being done. In Pakistan also it is being done. The need of the hour is to increase the facilities of centers which are capable of doing chorionic villi sampling, and then connecting them to laboratories which have the capacity or capability or expertise of doing the laboratory analysis.
Right. So that is the scenario if the baby is not born. So if the baby is born, then what happens?
If you have a thalassemia major birth, then very soon after birth, it will be diagnosed. If fortunate, in Pakistan, unfortunately, still many cases are not properly diagnosed or misdiagnosed. But if there is a strong family history, diagnosis should not be an issue. And once diagnosed, the patient will have to, in order to ensure life, they will have to receive regular blood transfusion, and the interval of these transfusion will gradually get reduced. And in due course of time, they will require regular chelation therapy also, which means removal of excess iron, which results due to repeated blood transfusions. And if you do not remove the iron regularly from the blood, that iron will deposit in vital organs of the body, like heart and kidney and your endocrine glands. And so this will affect the function of these glands. And also because there is anemia, so there is stress on other organs of the body to start producing blood. So you will have typical thalassaemic features, which is grey complexion, toxic looks, ill health, typical facial features. If the chelation and the transfusion therapy are not properly done. But as I said earlier, in the West, and this is now considered as a chronic disorder requiring multidisciplinary care. So in their patients, you will come across people suffering from thalassemia major who are 30, 40, 50, 60 years old.
Right.
But very well managed. And you would not know that they are receiving regular blood transfusions and regular chelation therapy because they are very well managed. Unfortunately, that is not the case in Pakistan. In Pakistan, you can recognize thalassemia patients from a mile away because they look unwell, they are toxic, grey complexion, the stunted growth. You just cannot miss them, and this is very unfortunate.
Okay, so you have mentioned that it's really unfortunate situation in Pakistan because they have to go for regular transfusion. So how often they have to go for these transfusions?
They start with about 3 to 4 weeks interval, and gradually it starts decreasing, especially if they are not well managed. and if they do not have access to a good transfusion center, then they have a very high risk of contracting infectious transfusion transmissible infections like hepatitis C, hepatitis B, HIV, even syphilis and other disorders. And that's why we have a very high incidence of hepatitis B, C, HIV among our thalassemic population. This is again very unfortunate.
Very sad scenario. So another very important thing is just like you have mentioned that in most of the developed world and even in some other developing countries, they are very much managed and they have a high life expectancy. So in Pakistan, what is the scenario? So how long they can live in Pakistan normally?
Generally, one is longevity of life, other is quality of life.
Right.
Unfortunately, these patients are doing very badly on both. They are able to survive usually around 20s, but during that time, their quality of life is very poor. Not only their quality of life, but also their family quality of life is very poor. Generally, there is a correlation between poverty, illiteracy, and this disorder. So you can well imagine, if someone has thalassemia major living in a rural area, not having access to quality healthcare, their life would be miserable. Every 2-3 weeks, you have to go and have transfusion and then chelation therapy. And then as you grow older, you require multidisciplinary care. And all this is not available to all the patients in Pakistan.
Okay, so actually, it's really hard to see all those patients. I've been to different thalassemia centers. I have visited, just like you have mentioned about those patients that you can like see them from a mile that they are suffering from thalassemia. I have like interacted with those patients, and really, that's a very sad situation. It's like you weep from inside of looking at those patients, and they have to go for regular transfusions, and then this iron accumulation in the body and many other ions accumulation in the body that's actually make them to suffer, and this is very sad. So that's why I think we should put a lot of emphasis on these patients, that they can have a better quality life, and especially the work on the prevention, that's very, very important. So we should have like on one side have a lot of focus on the prevention, just like you have like given the scenario. I know that recently there was like some announcement and the bill was also passed that each person who is going to marry, they have to get the test for the thalassemia. And then, so how practical is this
this legislation?
Yeah.
It's not practical at all. It doesn't make sense.
Right.
Actually, it just reflects the lack of understanding and comprehension of the disease and its dynamics in Pakistan.
Right.
As I said earlier, in Pakistan, this disorder is mainly limited to the affected communities. So if it is present in a small segment of society, why do you need to have a legislation which stipulates mass screening of the population? And we have 250 million people in the country. How can you go around screening everyone for thalassemia, especially when it is not even required? And even if you want to screen them, how do you diagnose them? Do you have the resources? Do you have the laboratory backup? Have you designated which are the authorized labs and the results of which labs would be acceptable when you go and get married? Haven't done anything like that. There is no mechanism of translation, of action of these legislations. And that is why we have these legislations in many provinces, 3 or 4 provinces.
Right.
And thalassemia is still getting out of control. So it clearly means that the legislation was mindless, unnecessary, and not implementable.
Yeah, so we should just being an expert, you have given a very good scenario that this is how we can easily, because these patients, they have to reach out to different health centers and different foundations that they are suffering from this. So only there is need that we can screen all those families, and then there is a role of genetic counselor. So what do you think, how many genetic counselors are working in Pakistan, and in this particular case, how we can the genetic counselor can play a role in the prevention of the disease?
Genetic counseling has a very definite role in managing the spread of this disorder in Pakistan. But uh, your question is how many genetic counselors we need? I have no idea because we don't have any idea how many patients are there actually in the country.
Right.
The figure I quoted earlier, 100,000 patients, that is just an estimate.
Right.
It's not an actual number which have been determined scientifically. And the 5% prevalence is also an estimate. This is again very unfortunate that we have made, the government has made no attempt to actually find out the true number of the patients in the country. It may be more than that, 100,000, it may be less than that. But we don't know how many patients are there. We don't know how much transfusion they need. We don't know how much unmet transfusion need is there. We don't even know how many thalassemia centers are there. So there is complete lack of data, and this is the most common genetic blood disorder in the country.
Right.
It is preventable, not being preventable, not being prevented, and we don't even know the exact burden of the disease, but we know that it is the highest in the world.
So on one side there is a role of government, and we know the scenario overall of the health status, because if we like see the statistics around the world, we are like ranked around 150th position in healthcare among like 200 countries. So the scenario is that not that good. So overall, like if we talk about not only thalassemia but other diseases, the burden is high, and there is much need to focus on the prevention. And I'm really happy to see like the Minister for Health, and he is often talking that we should have like more focus on the prevention of not only thalassemia but all the diseases. And this is like healthcare system should provide like more health opportunities for the people. And so on one side there is a role of the government. If we go on the other side is the like organizations and different societies. So what are different societies and organizations working for the thalassemia in Pakistan, and what is their role and what they are doing right now?
Actually, there are a lot of non-governmental organizations working on thalassemia, and they have come up in the recent past, in the 10, 15, 20 years, last decade or two. And the reason why they have come into existence is because the government has failed to fulfill its responsibility of taking care of these thalassemic patients and stopping the increase in their number. And so a vacuum has been created, which has been filled by the non-governmental organizations. And without their work, the lives of these thalassemic patients would have been even more miserable. But the whole situation is not very well managed or regulated, and so many of the centers in the public sector as well as private sectors which are providing services, transfusion services, chelation services, other services to the patients, are not very well equipped, or they don't have the sufficient resources and expertise to provide the service. So when we hear the minister saying that we need to focus on prevention, it is like music to our ears. But then we need an action plan
Right.
from the state, how to prevent the further spread of infections and other disorders. And as far as thalassemia is concerned, the strategy and way forward is very, very clear. Evidence is there, scientific evidence is there. Someone has to sit down and make a strategy and do something about it. And that is not happening, unfortunately. And the first step that needs to be done is to actually determine the burden of disease in the country, and then allocate resources accordingly.
Right.
In fact, we need to have a national thalassemia policy, and first of all decide whether we need to, we all agree to stop this disorder or let it proliferate. Obviously, we need to stop it.
Right.
And then next question is, how do we stop it? And then another question is, how do we take good care of the existing population? So there are many things that can be done to prevent its further spread. Legislation is one possibility, but that is not, I think, applicable to Pakistan. But there are so many other aspects like advocacy and treatment and CVS screening and diagnosis and so many other aspects. So the National Thalassemia Policy should cover all these aspects and come up with a consensus on all these different issues relating to thalassemia, and then make an action plan and a strategic framework how to implement the policy into action. And if we are able to do that, we will be in a situation like Iran and Turkey and Cyprus, and we should have no new thalassemia growths in our society.
So excellent, and definitely, Dr. Hassan, we have to ask the hard questions. They are very important. Just like you have posed the question that these are very important. The first question: either we are going to stop this disease from Pakistan or not. So this is the question we should ask ourselves, and I think we should involve all the stakeholders. They should like come in front, and this is how we can work together for the prevention of this very fatal disease, and we can have a better outcome. So the other, like now we go to another scenario. So we first have the introduction of the disease and scenario in Pakistan. So let's come out talking about the recent advancements in the treatment of thalassemia, not only in like Pakistan and the world. So what's going on in the world? So what are recent advancements in managing that? Just like you have mentioned, and I'm really delighted to know that even like those people, they are suffering from thalassemia, but you can't like find that they are suffering from thalassemia. But in Pakistan, you can have like a person, and you can have a very, even you are not a doctor, but you can have a very good guess that this person will be suffering from thalassemia. So what are the advancements happening in the world, and how we can translate those in Pakistan?
The latest advancement is gene therapy. You can completely knock off the thalassemia gene, and that's a permanent cure. But for a country like Pakistan, that is not really an option. Very, very expensive in this expertise, and just not affordable and accessible in Pakistan. The other option which we used to have was bone marrow transplant.
Right.
Again, it is very expensive, about 100,000 rupees for one patient. And even then, not all patients are suitable or fulfill the criteria for transplant.
Right.
And then they don't have, many would not have a donor, suitable donor also. So majority of the population, or almost all of them, rely on regular transfusion and chelation therapy if they can afford to have one, and whatever facilities are available in the public and private sector thalassemia centers. But in the past few years, 7, 8, 9 years, a new treatment option has become available, which is being practiced not only in Pakistan but also in the regional countries, China, India, Bangladesh, Iran. And this new treatment is the use of medicines which are not new.
Right.
And so these medicines are or have been used for other disorders, but it has been noticed that one of their side effects is that they increase the fetal hemoglobin level in the patients. And in the adults, you have adult hemoglobin, which is present within the red cells.
Right.
And this hemoglobin carries oxygen, and that's how you survive. But in the thalassemia patients, this adult hemoglobin is defective,
Right.
because of one of the chains is affected, beta chain. But during fetal life and shortly after birth, you have hemoglobin, which is called fetal hemoglobin, and gradually after birth, this declines and adult hemoglobin takes over.
Right.
So one of the side effects of these medicines, and this medicine is I'm talking about, is thalidomide. And also hydroxyurea. So thalidomide has this side effect of stimulating the production of hemoglobin F, fetal hemoglobin.
Right.
So fetal hemoglobin production can substitute for the low levels of adult hemoglobin in the thalassemia major patient. So if it is used judiciously and by trained medical physicians, then it has been shown that the patients who have been dependent on blood transfusion for many years, they have been weaned off transfusion and actually become transfusion independent. And some of them are excellent responders and maintain their hemoglobin around 10 grams. Others are not so good. We call them good responders, and other are even not so good responders. So,
Right.
even if you maintain your hemoglobin around 6, 7, and it doesn't decrease further, it is possible to continue. And if you are able to maintain it around 8, 9, or 10, you don't need transfusion. And there are regions in the country, like I have the opportunity to go to interior of Sindh, Tharpaka region, and there, I think the average hemoglobin level is 6, 7, 7.5. It's very, especially in the females and children, it is very low.
Right.
So just imagine if a transfusion dependent thalassemia major patient is able to sustain and have hemoglobin level of around 7, 8, 9. They don't need to have regular transfusions. Maybe sometimes occasional transfusion. Even that would be great. So this is happening in Pakistan in some centers, and it is being reported in very good international scientific journals also. But in other places, it is anecdotal evidence. But in the other countries, especially China, they are claiming very good results and getting it published in excellent journals also. So this is happening in the regional countries, but it is not happening in the West because they don't have this issue in the West. It's basically, as I said, an issue in the Mediterranean countries and South Asian countries. And that is why we do not have FDA approval of repositioning of these drugs for use in thalassemia major. And if we keep waiting for the West to endorse this new form of treatment of the already approved drugs, it may be many years in coming. FDA would not have these drugs on their priority because their society doesn't need these drugs. But in countries like Pakistan, especially, which has the highest burden of disease, we need to pay attention to this new treatment and streamline its use in the country and develop national guidelines and share our experience with the other regional countries and try to come up with a consensus on the efficacy of these treatments, because if patients are actually getting off blood transfusion through use of these affordable, very much affordable medicines, what are we waiting for?
Wow. So if I give the summary of what Dr. Saab has said, so the scenario is one of the option for the treatment is if we have to go towards the gene therapy, and gene therapy, there are very few cases so far in the world and it's super expensive. So this is my own area, so I have a good idea that how the things are working. The other thing is the bone marrow transplant, and the things are we have to do the matching. If it is not matching, then it's not working, and it's also an expensive procedure. The
And
other is
survival rate is also not so good.
so survival rate
depends
is
on the center to center, but that's also another issue to consider.
and then we have a new treatment option that he has mentioned about the fetal hemoglobin. That is we can stimulate the production of that, and that can definitely improve. So just I wanted to I'm just curious to know that how many people the study you have recently gone through are the good responders with this therapy, the new therapy that you have mentioned.
Yes, there's this group in Peshawar which has been doing this work for the last 6, 7, 8 years, and they have organized their data also. They have well managed data, and they have published their results also in good credible journals. And they claim up to 70 to 75% success rate.
Wow.
So this is certainly you just cannot ignore it. You have to look into it further.
Yeah. So what about, just like you have mentioned, that there are also good results from China and also from Iran that they have published in reputed journals. So what is their
Similar.
outcome? It's similar.
Similar. And so, all the more reason that we should interact with the regional countries
Mm-hmm.
and also share our experience with them and learn from their experience also and come up with a consensus plan on how to take this forward and before that decide whether we need to take this seriously or not.
Mm-hmm.
But in the face of overwhelming evidence, I think you cannot ignore it and you have to consider it very seriously. Again, this is the responsibility of the government.
So another, that's why actually I just wanted to have very technical question right at the moment, and that is like there are results from all these countries that you have mentioned, and they are published in reputed journals, and there is also one center working in Pakistan for the last like 6 7 years. So what is the bottleneck now? What like we have so many patients, so why this is not being like practiced in Pakistan?
You know, I can't put a finger on it,
Mm-hmm.
but you know, in all walks of life, unfortunately, I'm very sorry to say this, but in all walks of life in Pakistan, um, you come across apathy.
Mm-hmm.
You come up with anything and there is apathy. No one is, like you said, we are number one in hepatitis C, number one in diabetes, number one in thalassemia, polio.
Number
Uh,
one, also like the child mortality is one of
yeah,
the highest in the
infant
so
mortality, child
although like
mortality.
African countries are performing better than us,
Yes,
so with the nuclear power country with
yes.
like
So
so
there
much.
is, I mean, can you ascribe any bottleneck for all these problems? No, this is just apathy.
Mhm.
No one seems to be bothered about, these shameful statistics. So uh, I would just ascribe it to apathy.
Mhm.
Yeah.
So having this like situation, so I also like I can feel that we need to like work on the people as well, and we have to develop a culture where there should be more empathy among the people, and we should care for each other. And the scenario, just like the climate change and the recent situation in the northern areas of Pakistan, especially Pune and Swat. So I think we should come forward. We should help each other to bring like lives to those people and help each other whatever best we can do for each other. So having all this discussion, I think it's a beautiful discussion about all the scenarios of thalassemia in Pakistan. So this is the scenario, these are the solutions that are more practicable and we should implement those, and especially the treatment option that you have just mentioned. So this is like being done and the situation is quite improved in so many countries, only there is like need that we should go for it in Pakistan. So what do you think, like being an expert, being knowing the situation overall, so what is the way forward, how we can improve the thalassemia like overall, and especially the recent discussion that we had, the treatment option that they are available, and there is only need that we should have like multi-centric approach in which we should involve the public sectors and also the private sector. They should run some trials. Results are already there. So this is my own like thinking that we should involve all those. But being an expert, what do you think? What could be the way forward?
I think
What should be the first step in this regard?
I think primarily this is the responsibility of the government.
Mm-hmm.
As the minister says, we need to prevent diseases, and he also says that we need to prevent the number of people going to our hospitals.
Mm-hmm.
So you can start with thalassemia.
Right.
There's a huge burden of disease,
Mm-hmm.
which is causing a huge burden on the healthcare system, huge burden on the transfusion system. And if you have this option available, which is available, work on it. And if it comes off, then you can have a big chunk of burden removed from the healthcare system.
Mm-hmm.
And that would be a great success and the first step in reducing the number of people turning up for tertiary care in our system. And so, as I said earlier, also it is the main responsibility is the government.
Mm-hmm.
And then there are a couple of other partners also. We have, like all other countries, we have a Thalassemia Federation of Pakistan, which is the national federation representing, which is supposed to represent the patient community and their interest. We have this federation in Pakistan. Unfortunately, it is not been a very effective federation, and it doesn't have much to write home about. So this is an important platform which should be working on this um, um, new treatment option also, and also about how to fix the thalassemia situation in the country in general. But unfortunately, it is not performing its assigned role. And then the third partner is the Pakistan Society of Hematology,
Mm-hmm.
and that is also a national society for the country, like similar societies exist in all other countries also. So, as the biggest hematology disorder in the country, you would think that the Pakistan Society of Hematology would go for it and try to do something to fix the thalassemia situation in general,
Mm-hmm.
and look at the new treatment option in particular. Unfortunately, this platform, which is otherwise doing very good work, is still not taking this new option very seriously.
Mm-hmm.
So these are the three main partners which should be doing something to fix this situation.
Mm-hmm.
Unfortunately, uh, they
So,
are
what do you
not.
think? How we can bring all those on the table on this like very serious issue, and also how we can introduce all of them that this is being done in other countries? Why not? We should start in Pakistan.
Yeah, and then the other option is advocacy,
Mm-hmm.
which we are doing right now. So I'm
Right.
very grateful that you have invited me here, and we are having this very useful discussion, which I hope is useful for our listeners also.
Mm-hmm.
And so, through these kind of activities, we can sensitize the public, not just the thalassemia community, but also the general public, and sensitize them so that they can put pressure on the stakeholders and the government and all the other responsible organizations that they should come up with a solution to our problems. And so, advocacy is a very, very powerful tool for
Right.
bringing about change.
Mm-hmm.
And I'm very glad that you are exercising that option for advocacy from this very important platform of
F
Planet FM
87%.
87.6.
Okay, thank you so much, Dr. Saab, for enlightening us about the thalassemia scenario in Pakistan. Indeed, it's a very serious condition, as we have the whole like hour-long discussion on this topic. That this is the scenario in Pakistan. Unfortunately, if we can summarize the whole discussion, we have the highest burden of thalassemia in Pakistan. The prevention is very high. We are adding like 5-6,000 people each year among the patients, and the number is increasing. And unfortunately, it's like affecting the person very seriously. They need the transfusions, they need the chelation therapy, and so they are like in a very worsening condition, and we have to improve and the solution is there. We are really happy to know that, and you have worked on this issue, that solution is there in the world, that is being practiced elsewhere in the world. There are some centers in Pakistan, those who are also working on this new solution, and there is only need that we should also introduce this in Pakistan. And I'm sure you will continue your efforts in this regard, so we can have like especially the advocacy part, you can do it quite well. So I think you should continue, and I really wish that you should have a meeting with the health minister very soon on this topic, and so you can convince him that this is the solution, and this is how we can like improve the situation of thalassemia patients in Pakistan. So at the end, we would request you to please share a brief message with our listeners, with our who are watching our program, about this special like thalassemia scenario in the country.
Um, I think I would go back to the statement by the new health minister
Mm-hmm.
that we need to reduce the number of people turning up at our hospitals,
Right.
which means we should go for preventive medicine. And if we do that, we will not be number one in thalassemia, hepatitis C, diabetes, polio, or similar other conditions. We need to have now an action plan of actually practicing preventive medicine in the country.
Excellent. So the message is very clear, and that is we have to, just like the minister said, we have to work on the prevention. And Dr. Saab also said that we should have a focus on prevention so we can reduce the number of patients who are turning to the hospital. So with this message, we are very much thankful to Professor Dr. Hasan Abbas Zaheer with a lot of expertise for joining us today in FM 87.6 and enlightening us about the scenario of thalassemia in Pakistan. So we'll continue our discussion. If you are an expert of any field and wanted that we should highlight some of the issues, or if you are an entrepreneur or innovator and you want to you would like us to tell your story about your invention, about your innovation, do join us at Planet FM 87.6 and we'll definitely highlight your story. And this is how we can bring a positive change in Pakistan. Thank you once again for joining us today in Planet FM 87.6 at Radio Pakistan.